Good afternoon, everyone. I'm Sayukta from beautiful Spotless Skin Tea. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which makes skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of, and that makes us not to include sunscreen as an integral part of our skincare routine. So, to keep you informed today, we are here to know more about sunscreen in skincare regimen. So, let's connect today with our skin expert, Dr. Apoorva Ragavan, dermatologist, aesthetic dermatologist, and trichologist from Chennai with over 6 years of experience. Dr. Apoorva has pursued her MD Dermatology from Meenakshi University and has been bestowed with Gold Medal Award in 2017. Dr. Apoorva currently practices as at Apollo Hospital in Kilpauk, Chennai. Her clinic's name is CH33 Clinic, again stationed at Chennai. A very warm welcome to you, Dr. Apoorva. Hope you're
Thank
doing
you.
good.
Yes, I'm doing good. How I hope all of you are doing good as well.
Yes, absolutely. And today we are going to talk about a very important and interesting thing, that is sunscreen in our daily skincare routine. So, doctor, to start with, many people are surprised and they keep on asking. I'm sure you get patients with the same question: why should I wear sunscreen every day? Please enlighten us about it.
Yeah. So I get this question targeted at me almost every single day in every consultation that I make, be it for like a skin disease or just some pigmentation on the face. I get asked as to why should I use sunscreen? I stay indoors. I go out probably for 5 minutes. Even for those 5 minutes, should I wear sunscreen? I'm in the IT. I'm in night shift. I don't really get to see the sun at all. But a sunscreen, technically, though it was called as a sunscreen, I think it should be renamed as a light screen, because any source of light can actually cause long-term damage and change to your skin. So sunlight consists of many different wavelengths of light, all the way from the infrared, where you only feel it as heat. It can be ultraviolet rays. It can be the visible spectrum, where we see the colors, and then there are the X-rays and microwaves. Believe it or not, all of these wavelengths of light can damage our tissues in many different ways. So even though a person gets very, very minimum sun exposure nowadays, even during lockdown period, hardly any of us went outside. But even then, we saw a lot of pigmentation problems developing during lockdown because we all had immense amount of screen time. So this goes to show that not only sunlight, but blue light that comes through our screens, our phones, laptops, TVs, etc., can also damage. So whether you got it, I mean, whether you go out, whether you don't go out, all of us at some point are faced with sources of light. Otherwise, we'd be living in a pitch dark world, and that is why sunscreen is absolutely essential.
So even if the name suggests a sunscreen, but as you very rightly said, it should be renamed at light screen. So it's very important because it protects us from the harmful radiations emitted from various sources of lights. So, doctor, the thing is that still many people in India are not using sunscreen as a daily skincare in their daily skincare routine. Now the thing is that they have various complaints or things to say about sunscreen. Many people will complain saying that it makes my skin very dull or patchy, or I sweat a lot after applying sunscreen, or my oily skin becomes more oily when I use sunscreen. Now, how would you like to address these kinds of complaints that people normally come up with?
Yeah. So what I see happening nowadays, even me, so I am a doctor in the clinic, but outside I am a consumer like anyone else. So I see the immense amount of advertisements and stuff going on that really confuses people. There is one product that, claims that it will brighten your skin, lighten your skin, clear the acne. do everything that, what we use 5 creams for, they advertise it that one cream can do everything. But the reality is a lot of people are misguided by information on the internet. And, if someone's a so-called influencer or someone, even if I use a sunscreen and tell you that this suited me, this might not suit you. Right. So basically, one should understand their own skin type, and skin type is not something constant. Your skin type changes throughout the age. It changes with what environment you're in. A person, when they travel to Bangalore, Delhi, or to the Himalayas, can have a different skin type. When they come back to Chennai, it might be different. So understand your skin first. And for that, the best person to meet is a dermatologist, because we have seen, our only job is to treat your skin. So we analyze your skin type. We can point out these seborrheic areas. Like if you can look at me, I have a pretty oily T-zone. So I would not choose a sunscreen which is very heavy, which is not oily or very cream based. I would probably choose something matte based or gel based. But this is because I know my skin and I've experimented on it enough to understand what reacts to what. So we have experience in that. And then when you have a doubt, you should meet us first. You can get a skin regimen. Most of the times what we do is we analyze your skin and we make a routine for you. Okay, for the next 6 months, your skin type is going to be like this when you're on treatment. So these are the products you should use. And this is the type of sunscreen you should use. But, again, a lot of social media stuff which is going on tends to confuse people. And they look also fancy and very nice. And you'd want to try that. And sometimes you end up making the wrong choice. I've seen a lot of people use the wrong sunscreen, end up in heavy breakouts on their face. And we've had to go back from scratch, treat that, and then put them on a proper sunscreen. So I guess that this half-baked knowledge is more dangerous. So it's better to come off to the professionals, and we can tell you what type of sunscreen is better to use. Once you get hooked on the right sunscreen, you will never go back. You will want to use it every single day.
I can completely agree with what you're saying. And definitely, with all the marketing gimmick and n number of products in the market, and every time, even if you're logging into any of your accounts online, you'll get so many advertisements of various products, and definitely people get confused. So dermatologist is the right person to go for help. And doctor, as you said, it's very important to keep a simple skincare routine, and which is regular at the same time. Now my question is, for a normal person who is not having many complications or skin conditions, or may have oily or dry or combination kind of skin type, what should be a simple basic skincare routine?
Okay, so first we would analyze your skin type, combination dry, oily, sensitive, whether you have any eczemas, rosacea, something on your face which you might not even know of. But when we look at you, we will know that. So I think what people find very hard nowadays is consistency. They don't want to do anything for a long time. They want to use one face wash, which will do the job of a face wash, a sunscreen, a shower gel, a shampoo, everything, and just be done with that, right? But I feel that the same way, like, we either go for a walk or we stick to a proper diet, is the way we take care of our body. And skin is the largest organ of the body. So give it some love, give it some care, give it some time. So what I would suggest is, once you get to know your skin type after visiting your doctor, get one good cleanser. Stick to that. Cleanse your face morning and evening. And it's a huge myth that oily face does not need moisture. It's very, very wrong. Oily face is just oil. It's not moisturizing. Oily face still needs a moisturizer, a good moisturizer that doesn't worsen your oiliness but hydrates the skin. Okay, a good cleanser, a moisturizer, a sunscreen, and one night cream with some active ingredients suited at your issue. You have really dry skin, get a heavy moisturizer for the evening. You have acne, get something with retinol, get something with adapalene. If you have pigmentation, get something with niacinamide, arbutin. There are so many other compounds available, but we'll have to choose and see which one suits you best. And often at times, even when I give a prescription to a patient, it's not the first prescription that will stick. We have to rotate through some products. And then we come to a match where, okay, I like this product, I like using it, I'm seeing the results, so I will use this continuously. It takes about 2 or 3 months to get there, but that is very essential. So this basic 3 to 4 step is enough. Now, I know a lot of us must have heard of the 10-step K-beauty, the Korean beauty 10-step facial routine, which has like a serum, an essence, an ampule, a sheet mask, etc. If you have the time, go for it. It's really, really rewarding to do it very constantly. But there are products available which condense 1 or 3 of these steps into one, and which are really good. So you can start off with that. So basically, I like to get my clients started on the basic routine first. Do that for 3 months. Show me that you can stick to this routine, and then let's add on more steps.
Right. Because many people often say that they don't have the time to, follow a skincare routine. But with what you just told, it's so simple, so basic. I'm sure everybody can do it.
I
And
think it's more about making time than having time. As to with everything in our life, right? You want to go for a walk, it's very easy to say, I'm so busy, I don't have the time. But if you can make that 5 minutes for your skin and 25 minutes for your walk, and you just stick to it for 3 weeks, that's the time it takes to show any difference.
Exactly. Right. So please, people who have still not started, using sunscreen or maintaining a routine of skincare, please start immediately. Keep it simple, keep it basic, but do it on a regular basis, and do consult your dermatologist who can analyze your skin and advise you on the right products to use. Now, doctor, whenever we go for buying a sunscreen, there are so many informations on the box, and the very first thing that attracts our attention is the SPF. Now, we would like to understand what is SPF, how to choose the right SPF for ourselves.
Okay. So SPF basically is the short term for sun protection factor. It's a ratio of how long this particular skin type, so my skin type is different from another person's. So this particular skin type, how long does it take to burn without the sunscreen and with the sunscreen? It's basically a ratio of that. So the numbers range from 10, 15, all the way till I think 150 now.
Okay.
So for Indian skin, a basic SPF of 30 is good enough. If you see, SPF 30 gives you a sun protection factor of about 93%. Okay. When you look at SPF 50, it gives about 97%, and SPF 100 gives only 98%. So there's a small jump in the number there. It's not significant. So we recommend 30 as a guideline for everyday use. If you're going to a very high altitude area with huge exposure to sunlight and UV rays, then go for a 50. You're an extremely athletic sports person, you do mountaineering, your skin is going to get burned, then go for the 100. 30 is the standard. Don't go less than that, because it might not be effective, because none of us, I think I'm also guilty in this, none of us apply the amount of sunscreen that we're supposed to apply. So if you're actually supposed to, so can I just tell that off here?
I was about to ask you that only, that how much quantity of sunscreen we need to apply actually.
So there is something with numbers, it is 2 milligram per centimeter square. That's not needed for real life people. Half a teaspoon or little bit more than half a teaspoon is what they say theoretically, but no one is going to measure the teaspoon rule with the sunscreen. So now something that has come out is the 2 fingertip rule, 2 finger rule. 1 line of sunscreen here, 1 line of sunscreen here. In your middle finger and your index finger, that is enough for the full face. Okay. And a similar 2 finger for the front and back of the neck. So the 2 finger rule is something you can understand easily. So this entire, you don't need to fill the finger like you're coloring with a crayon. 1 line here, 1 line here.
Right.
Full face. And ideally, it should be reapplied every 2 hours. It's very, very difficult on a real life basis. So they have come out with formulations which theoretically last for 6 hours. But let's take that with a pinch of salt as 4 to 5 hours. And I would tell them, so usually what I tell my patients is, if you do it at 8 in the morning, please repeat at 12 in the afternoon. And if your sunset is going to be very late, please repeat at 4 in the evening. Okay. Because even then, once we come back home, we have indoor lighting. Right. It's not like though just the sun disappears, the light is still there. Exactly. So yeah, two finger rule, every 2 hours ideally, or every 4 hours. And every day, 365 days.
Okay. Now, again, as you were saying when we were discussing about SPF, that, different people, as per their work culture or routine, may need different kind of SPF, but the basic is 30. 30 is good enough for an Indian skin type in the Indian conditions. But the thing is that when we talk of reapplication of sunscreen, again, many people come up and, put excuses that I have such a busy schedule. I just don't have the time to, apply sunscreen. Not even once. Okay, I'll do it once if you're asking me to do so. But reapplication is just not possible. What to do? Because many people feel that, to apply something on your skin again needs the whole, thing of cleansing, moisturizing, and application of sunscreen thereafter. So what those
So
very
we
busy people
actually
get to.
ask people to apply sunscreen even on top of makeup. It doesn't
Okay.
matter.
Mm-hmm.
You can apply sunscreen first and then your base layer of makeup. And if you want to reapply your sunscreen, when you're reapplying your sunscreen, you can do it just on top. There are now newer formulations like a stick sunscreen, which is very easy, very on the go. So you can make sure you're applying your sunscreen. There are sprays available. You don't need to get your hands messy at all. You don't even need to cleanse. And there are top-up mineral sunscreen powders, which give you up to SPF 35 with just a powder.
Okay.
Those might be really good option for these oily faces. The powder can help you blot that excess oil and give you that, little cover of sunscreen.
Right. Now, there are people who sweat a lot and they will always complain that, the moment I apply sunscreen, it's gone in like a minute or 2 minutes time. Now, what to do?
Again, there are many formulations available. Some of them are very sweat resistant. There are only few brands which are actually good sweat resistant sunscreen. So you have to try a couple and then see which suits you the best. And when you sweat, just don't do like this or then wipe your face fully, dab it off. When you dab it off, you're taking off very less of the sunscreen, right? And by the time that you start sweating, it is very humid here in Chennai. So I know how much when we come out of the shower and we apply sunscreen, it does feel like you sweat, but that's temporary. In the minute that you go into the fan, it is going to kind of settle down onto your face. And as the last layer, you can dot a bit of, some, like a compact with SPF. You can do that on top to make sure not all the sunscreen is melting away. And you can carry that compact with SPF with you. So the compact with SPF is not going to replace your proper sunscreen. Your real sunscreen is still the one that does the work. But to make sure you have something with you on the go, you can do powders.
Right. I was coming there because many people again have this question that do I need a standalone sunscreen or because all my makeup products, my CC cream, etc., they do have some amount of sunscreen. So are they good enough or do we need to have a standalone sunscreen?
No, they're not good enough. Often they have multiple jobs to do. They need to give you coverage. They need to blur out the pores. They need to give you this luminosity and they need to be SPF so that it's a namesake SPF that they have. You can't really compare it to a medical grade sunscreen. So that's why I said you can cleanse, you moisturize, you put on your sunscreen, and then you can do your makeup on top. So the sunscreen is a separate individual component which shouldn't be mixed up with everything else.
Right. Again, many people in India faces a lot of, pigmentation related issues like melasma, hypopigmentation, and women again are the biggest target. Now, if they start using sunscreen well in advance and, keep it really consistent and regular, is it going to prevent them from having melasma or hyperpigmentation, etc.?
So one can't use the term very confidently that it will 100% prevent. The onset might be very delayed. The severity with which it comes might be very mild. So we can get away with milder treatments for it. Right. And sometimes it might not happen at all. If you've been so religious with your sunscreen, it might not come up at all. So I would say the ideal age to start using your sunscreen is in your 20s, not your 30s.
Right. And again, with those who have a very, sporty or they have a job in the field under the sun, of course, their, application, reapplication, and what SPF they're going to choose is going to differ. But still, anything on for them?
If you can, and if you don't mind, please wear a cap or a hat when you're outdoors. Physical protection is equally as important as sunscreen protection. So we recommend patients who have very sensitive skin or who already have a lot of pigmentary problems to wear a wide brimmed hat or a cap. So men can easily get away with a cap, that's easy. Women might feel a little bit awkward, but they're okay holding an umbrella or a hat. So physical protection is also very good. if you're having a lot of outdoor activities, there are even UV protective clothing that's available nowadays that scatters the sunlight and doesn't let your arms get sunburned. You might see a lot of women riders wearing those long gloves. Sometimes they're not the correct material. You need a correct UV protective material. But physical protection is also equally important.
Okay, so sunscreen and physical
Yes.
protection can go along for, especially for people who are constantly under the sun.
Yes.
Now, again, patients who have acne or whose skin is acne prone, they again say that, you know, sunscreen is going to make my skin condition worse, and thus they do not use sunscreen. Would you like to shed some more light on it? You know, what to do, especially for
Again,
acne
I
prone?
think it's just a sad case of product mismatch, where they've chosen or they've been given a wrong sunscreen for their skin type. And constant use of that would have led them to have so much breakout that they lose belief in the sunscreen. So using a gel-based sunscreen is very, very important for a person with very oily or combination skin. And that is why moisturizer is also important, because it's going to soothe your skin and make it hydrated. So what happens is oil doesn't really hydrate the skin. Oil stays as a film on top of your skin. The underneath skin is still dry. So when you moisturize, you prevent the overproduction of oil. And when you don't overproduce oil, you can get away with wearing sunscreen and it won't clog up your pores. Using a gel-based lightweight sunscreen and other products which will help in your acne, like, you know, what medical grade products we give you, will all have, see, each in our prescription, if we make something for acne, each one has its own role.
Right.
So when you use them together the way they are meant to be used, you will never break out even if you're using a good sunscreen.
Right. Again, as I was saying in the beginning, that, you know, 67% of Indian people are still not using sunscreen. And they'll often say that, you know, maybe I'm not getting the right kind of sunscreen, or they would love doing home remedies or going for, you know, other stuffs rather than going for sunscreen, or at least consulting a dermatologist. Now, how far these home remedies, etc., can protect their skin from harmful radiations?
Home remedies.
Yes.
I don't think they have any big role to play here, unfortunately. So imagine the use of a sunscreen, or let's say one active ingredient product. Let's say, for a very easy example, as I recommend someone to use a retinol. And then someone says there is retinol in carrot. So why can't I eat carrot? It's like, as a layman example. You would probably have to eat and metabolize 5 truckloads of carrot to get the potency of this size of a drop of retinol cream. Which is why there are people who put their money and research into making such products for us. Of course, I'm not telling people not to have a healthy diet. That is one of the cornerstones of having healthy skin. But it's not going, it's an additional thing. It's not going to replace it.
Right.
So home remedies, again, like our social media products which we see, there are so many home remedies. And unfortunately, we see a lot of steroid creams being promoted as homemade creams, very sadly, and they have a very high abuse potential. So steroid creams are marketed as, I can't mention the names here. There are some creams which you can buy online from these private sellers, and they say it's a homemade fairness cream with saffron and all that stuff. But when we actually see the patient using it and they've come back after a couple of weeks, we can see signs of steroid-induced damage. So that's how bad the situation is nowadays. And see, if you're sticking with applying something like multani mitti or curd or something at home, it's harmless, but it's not really going to do any good. Probably for that one day, your skin might look soft and nice. That's about it. It's not really going to help too much. Yeah, that's all about home remedies that I can say. Again, you know what, if you can consult with your doctor, we can even tell you what home remedies will suit you and what will not suit you.
Exactly. The whole, you know, purpose of having this session, apart from raising awareness over sunscreen, is to make people understand that it's important for us to go and consult a dermatologist because they are the expert of skins. So they know our skins. They'll understand what's going on, and they can advise the best products for us. So rather than wasting our energy in home remedies or over-the-counter medication, or buying 10 bottles of sunscreen or other products, it's always good to go and consult the dermatologist at the first place. You can save your money, your energy, your skin, which is
Yeah.
the most important thing.
And
So please don't waste.
they're all people like you in about the similar age. So believe it or not, whatever you have wanted to try, I would have already tried on my face. I would know what has worked, what has not worked, and how do I deal with the damage by doing what I did. Right.
Exactly.
So yeah, you can just treat us as a specialized friend who can tell you what to use and why you shouldn't be using this.
Exactly. And doctor, what about children or kids? I mean, is it safe to use sunscreen for them because they are so playful, or they are mostly, under the sun, etc.? So, what's your advice for them?
They should also be using sunscreen. I see a lot of parents coming and asking me for sunscreen because their children have tanned playing outside. One, I want to break the myth around tan, that it's a very, very natural phenomenon. We all have melanin in our body. Melanin is the pigment which is produced by a cell called the melanocyte. And these melanocytes react to sunlight and they produce melanin. Melanin protects our skin from UV damage. So UVB, which is present in the light that comes from the sun, is potentially cancer causing. So people who really lack melanin, you can see in the Caucasian population, the Australian area, they are more prone to skin cancers. We are not prone much to skin cancers because we have melanin, but we don't like it because we tan. But tan is a temporary phenomenon on its own. Left, it should go away in like 2-3 months. Even with the use of gentle skin lightening agents, it will go away. It will come back because you're living in a tropical country. Constant use of sunscreen can make the tan less on your face. It's not going to make you never tan. That's one misconception. People will ask me, I'm using sunscreen, but I'm still tanning. You will still tan to an extent, but the sunlight, whatever is hitting your face, is not going to damage your DNA. It's not going to damage your skin cells. It's not going to rupture them. None of that is going to happen. So I think tan is okay. It's livable.
Okay. I'll also take some of the questions that our viewers are asking. So Rishabh Singh is asking, can I apply sunscreen directly on face?
So there are some sunscreens available which come mixed with the moisturizer, medical grade ones, not. Yes, those you can apply directly on your skin. But if you have a skin condition, let's say you have a very dry skin, the sunscreen cannot do the entire job of moisturizing and the sunscreen. So do a moisturizer or something first and then do your sunscreen.
Okay, Asha Sain had the same question. Can I wear sunscreen without moisturizer? I'm sure the answer would be the same, right? Okay, let's move on. Pooja Pandit is here asking, is spray sunscreen okay to use?
Yes, the medical grade ones are okay to use. I'm not really sure of what over-the-counter brand sunscreens there are in the spray form, but there are 2 or 3 medical grade brands which are really good in the spray form.
Okay. Aarti Meena is asking, can I get a higher SPF by adding the SPFs from 2 different bottles?
I don't think that it works that way. It's not an additive effect. No.
Yeah, 2 plus 2 is not always 4.
It's not going to happen like that. You get 2 layers of 50, but you're not going to get 100.
Exactly right. Priyanka Rajput is asking, what is the best SPF to use?
Aim for a minimum of 30. Can go up to 50. I would not recommend you to go more than that. One thing I'd like to tell all the women and girls who use sunscreen, especially women with pigmentation, look for tinted sunscreens, which give you this beautiful finish of a light foundation as well, because it has iron oxide in it. Look for stuff which has iron oxide, medical grade sunscreens, because iron oxide protects you from visible light, this light, the screen light.
Okay.
So there are now sunscreens available, like even the one which I'm wearing right now has a very thin layer of iron oxide mixed into it. So it looks like a bronze foundation color. And that will give you the benefit of, covering up some of the marks, covering up some of the pigmentation. So you'll be happier to use the sunscreen. Like, not only is it protecting me, it makes me look good also.
Exactly. Right. Priyanka Rajput is asking, what is the difference between physical and chemical sunscreen, doctor?
Yeah. So chemical sunscreen use something called organic filters that can be UVA filters, UVB filters. They are usually salicylates or PABA derived agents. So they are chemicals which interact with the sunlight and nullify the effect of the sunlight or the light. And then you have physical or inorganic sunscreens which are made from zinc, titanium and iron. So the inorganic sunscreens, they are made from pure minerals and metals. So they have to be grinded up nicely into a nano-sized particle. Otherwise, it look, you've seen those sports people with a thick white sunscreen. That's usually zinc oxide because it's a mineral sunscreen. But there are now newer formulations where they've made an ultra microscopic size of this particle. So it looks nice without that white cast. Now, a lot of sunscreens that are available to us medically are a combination of organic and inorganic sunscreens, and they work really, really well.
Okay, so it's all about finding the right sunscreen as per your skin type and your work condition, and definitely a dermatologist is going to help you with that. And in case you didn't find the right one at the first go, have patience, you'll eventually get the right.
Even I've gone through some 10 sunscreens before I found one that I like and works for me. So
yeah, and when you finally discover, okay, this is the one I was looking for, that's it, because then for the rest of your life you'll have to use sunscreen. But again, as you said, your skin type may change or so in that case, again, you can go and consult your dermatologist, again start the trial and error path, and that's it. But yeah, you need to find the best thing for yourself, and a dermat is going to help you on that. Many people say that, as we were talking in the beginning, that it's raining, so there's no sun, so I don't need to use a sunscreen, or it's cloudy, or it's winters, or I hardly go and expose myself to the sun. I'm just moving in the car, which is all air conditions, etc. Again, what's your take on that?
So I have told you about the screens, but even us standing near the gas stove, even those forms of heat that we face will also damage the skin. So on a rainy day, it's very unbelievable that even though you're not going outside, you will be looking at your phone, you will be watching TV. That will still be happening, and the light damage will still keep happening. If you shut yourself off completely from all sources of light, then yes. But I'm sure even after going to bed, we're still looking at the phone. That is still damaging your skin at night also.
So even if right now I'm working in front of a laptop, the radiations coming out is actually damaging my skin.
Yeah. In fact, I've reapplied my sunscreen because I know I'm going to be looking into the system for 1 hour.
Okay, so it's that important.
Because we're seeing people, especially with the advent of IT heavy work, and people, not even IT heavy, everyone, all professions nowadays have to deal with the computer or the screen or the tab in some way or the other.
True.
Right? Or stand under a lot of artificial lights. And we have people in their early 20s coming us, telling us that they are, you know what, I have very deep under eye circles. I've already started forming wrinkles and lines. It's because we are exposed to so much more damaging stuff than our parents. Our parents never had to grow up with all of this.
Exactly.
So that is why even sun protection when you're indoors is very important.
Right. And as you mentioned that even the, fire or things like that also do complicate the thing. That means the women or, housewives who are constantly in the kitchen, they are equally at danger.
Yes, definitely. In fact, you will see people who are hovering over the stove and cooking meals 2 to 3 times a day will have a lot of fine lines and textural changes in their skin, even in their early 40s and 30s also. What heat and light do is basically, they eat away at the foundation of your skin. So our skin has elastic fibers and connective tissue in a complex like this. It's like a basket. Okay, this is the foundation of the skin and gives us that supple, young, youthful skin. Now, your skin starts to damage and go like this when there's a lot of light induced damage. It becomes loose. The fibers become loose and it starts sinking. So it's not able to support the structures anymore. So it starts sagging. You start seeing fine lines and lines around the eyes. Even your pores can become bigger with a lot of light damage.
Okay. Sonia Ahuja is asking, if I applied sunscreen in the morning and stay indoors, do I still need to reapply it in the afternoon if we are going out briefly, like
Highly
going to
advised.
your car and
Highly
walking to
advised.
the
Your
shop?
sunscreen, whatever you applied in the morning, will be gone within the next 2-3 hours. It's already used up.
Right. So the way you need to, eat at least 3 meals a day or you'll become hungry, etc. The same
Exactly.
way
That's a
you
very
need
good
to,
way of looking at it. Yeah.
uh, so yeah, the same way you need to reapply the
Yeah, all of us
sunscreen.
reach for a snack. We want a coffee in between, something to recharge ourselves, right? In the same way, your
Exactly.
skin needs a recharge as well.
Exactly. And another way, common query from people who are still not using sunscreen, they'll say that I'll become vitamin D deficient if I use sunscreen. I'm sure you'll get patients with the same question. How you come to that?
Okay. So ideally, the vitamin D that we need is produced between 11 a.m. and 1 p.m. I'm pretty sure not many of us are going to stand in the sunlight between 11 a.m. and 1 p.m. It's way too hot. But studies have shown that even weekly 3 to 4 times of exposure to medium level sunlight will give you that enough vitamin D that you need. And even under sunscreen use. So like I told you, no one really applies the complete 2 finger or that half a teaspoon. We don't really do that. So even if a person does that much sunscreen and you produce vitamin D occasionally, imagine that we're not even applying half that amount of sunscreen. So we will be getting vitamin D production. It doesn't stop even in children. Somehow we find that all Indians are vitamin D deficient, even those who are farmers and athletes and sports persons. So one of my theories is that the standard of vitamin D for Indians itself is wrong. We need to have a standard of our own and not compared to the international standard. So it's just a myth that sunscreen will stop vitamin D production. There's nothing like that.
Okay, so if viewers, you were not using sunscreen just because you thought it was going to make you vitamin D deficient or your skin won't be able to absorb vitamin D, that's a myth. So stop doing that. Start using sunscreen. And doctor, as you said, sunscreen you should start using from your 20s. As a kid, if we have a very hectic or exposed way of living, then again the kids should also be put on sunscreen. Now my question is that sunscreen is going to be the longest time of my life I'm going to use sunscreen, and reapplication again makes the number goes up. Now my question is it okay? Is it safe for the skin even in the long run?
Yes, it is safe, because as long as there are not any harmful molecules. There are some people who are allergic to certain components of sunscreen, so obviously you will avoid that. But sticking to something which has a good blend of both organic and inorganic, that is the physical and chemical ones, even for a long-term use, like I told you, when you apply the sunscreen, within 3 hours it breaks down and it's gone. It doesn't really get absorbed into your body. We can't do a blood test and find out that this sunscreen chemical has been found in this person. It doesn't work like that. It interacts with the light, it changes its physical chemical nature, and it gets neutralized. That's it. So
Okay.
it has no retention potential. If it had retained, why would we ask you to reapply it?
Exactly. Fair enough. And doctor, before we wind up the whole session, any take-home message for our viewers?
Yeah. So I know it's difficult for a lot of us to even wrap our head around the idea of having to use a sunscreen regularly. But in this era of people being more concerned about their skin and appearance and everything, sunscreen is going to contribute the same or not, if not more than your makeup or whatever you do, because your healthy, good skin is the foundation of makeup. You can't cover all of it all the time. Would you rather think that it's better to spend too much on makeup, or is it better to spend on using a good sunscreen that's going to protect your skin for life? Right? I think that's where I feel a lot of people will say that, I'm going to be spending so much on sunscreen. But if you spend the correct amount on the correct skincare, you will not need much makeup at all, right?
Exactly.
And that's the trade-off.
Right. So if you want to save energy, save money, save time, save your skin, then please apply sunscreen, good quality sunscreen, which is as per your skin type, suits your daily schedule, etc. And again, if you want to save on energy, time, money, skin, then you need to go and consult your dermatologist before doing anything with or over your skin. Thank you so very much, Dr. Apoorva. It was wonderful talking to you. Thank you so
Thank you
very
so
much
much.
for your
Thank you.
valuable time. We really look forward for many more such sessions on various issues for our viewers
Thank you
in
so
coming
much. It
times.
was very nice. You've been a very, very good, very nice host. Thank you.
Thank you so very much. And viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.